Anna. I'm the cosmetic consultant at Heartland Plastic and Hand Surgery, and through the process of your consultation you will meet me. At the end, a lot of times I will take your photo, and in that case you guys sometimes give me hints and ideas on what to make the process better. So what I want to do is pass those on to you, so maybe you can have this actually before the procedure's done. So I've got the information, some supplies here to kind of explain how it works. The first thing I want to talk about is some of the supplies you might want to purchase. Some of it will come with you at the time. One is your abdominal binder. Your abdominal binder is what's going to give you compression after surgery, and it's very easy to put on. This is actually, there's 9-inch and there's 12-inch. Because I'm feather tall, I went on and grabbed me a 12-inch, and it is basically just stretch it and then put it on. And then people ask questions when they get their little sheet on what supplies to have. Some they ask why to have them. One of the things we have on there is actually a Kotex pad, and that is because you do have an incision that goes from hip bone to hip bone on a tummy tuck. And a lot of times anything that rubs it or irritates it, it's kind of painful, and as we all know, pads are kind of padded. And basically what you do is you undo the sticky part and you place it underneath your garment, underneath your underwear, and put it right where it can be cushioned on the incision itself. So that gives a lot of extra stuff. After surgery, you also have drains in. Drains usually stay anywhere from 2 to 3 weeks. Factors to determine your drains: how hot it is outside, how much bending and twisting you do. Let me explain a little bit about the tummy tuck so you can understand why this kind of insinuates for the drains to be a problem. So what happens on a tummy tuck is the incision goes from hip bone to hip bone. They pull the skin all the way up to the rib cage, and basically you're seeing the muscle wall. They tighten the muscle wall, but when they go to pull the skin down and get rid of the excess skin, it creates a void there. The skin doesn't automatically just go back down. We want the skin to go back down. So what happens is they put the drains in, because anytime they have a void, the body actually puts fluid there. So this is a drain, and what will happen is this part here will be in you, and this would come outside of the drain. Some of the drains come out to the side, some of the drains come out in the middle. It's different for people. It's no big deal that they're different. And basically it keeps track of the fluid. You'll keep a chart, and when it gets down so low, then they'll come out. And trust me, that everybody wants them to come out. So the thing we need to talk about is what encourages more fluid. Bending, twisting, if you think about getting your clothes out of the dryer, that kind of stuff, the twisting like that, the more that skin rubs, the more we have a problem with it not sealing down. So it's very important, stay in the air conditioning, don't do a lot of housework, lifting kids, twisting like that, that's a problem. I want to talk a little bit more about the actual after surgery also. So taking a shower, people ask the question, what do I do with my drains when my garment's not there to hook the drain onto? Well, let me give you some hints here. One of the people came through and they said they took like a headband, they put it on the top of their thigh, they attached the drain to it, and they used that to attach their drain so their hands could be free. Another person came through and said that they used basically a carpenter's pouch, put their drains in it so their hands could be free, and that held that. Another person actually recently came in and they had like a long chain, and they attached the drains so the drains could be moved from side to side while they're in the shower. Another thing that's a little bit of a helpful hint on the shower part is you've just had surgery, you're tired, you're on pain medication. It's probably not a bad idea to have a lawn chair if you don't have an actual seat in your shower. You're going to want to sit down, wash your hair. It's going to feel wonderful to take your shower, but you need to do it in a safe way. This will give you time to rest and then keep doing it, so it works out really well. Last thing I want to talk about is the recovery scar gel. The recovery scar gel is something around 2 to 3 weeks after surgery. The physician will say it's time for you to start using it. You'll use it twice a day, and you'll put it on kind of like cake icing, and you will actually use it till it's completely done, and I would expect it to be several weeks. Some people, we decided they would do another one after this, and we'll talk about that as it goes. But again, this has been very helpful. We've been using it for the last year. I hope some of these hints kind of help you guys, and know you can call the office at any time. We'll answer any questions you have, but I hope this helps you ahead of time. Thank you.